Let's cross over to Strasbourg to speak to our correspondent there, Shona Murray. Shona, good to see you. The WHO says Europe's COVID death toll is likely to pass 2 million by March. Epidemiologists saying there's a clear link between rising case numbers and low vaccination rates. What's the level of concern where you are right now?
Oh, that's right, Paul. When we saw those statistics that you mentioned there in relation to the correlation between countries with high levels of vaccination and fewer deaths, and then the opposite in the fact in countries like Bulgaria with 29% vaccinated and well over 300 deaths per 1 million. I'm joined now by Peter Liese, who's a German MEP. Peter, you're on the Health Committee. I mean, okay, first and foremost, how do we get the rest of Europe vaccinated? There's a supply there, but countries like Bulgaria with 29% vaccinated, Austria 64%, and parts of Germany not that well vaccinated.
Yeah, this is unfortunately true. This is also our biggest problem. There are other problems. The protection rate of the vaccine goes down, and we have the Delta variant, so also twice vaccinated people should be careful. But it's very clear in my country, Germany, the regions where we have a high vaccination are much better off, and that's also true for Europe. So I think it's important, of course, to continue to speak, to explain people, to take their concerns seriously, but we also need to go a step further. I think we need to have much more use of the certificate, and people that decide not to be vaccinated cannot get the same rights and freedoms than others because they are a serious threat to our healthcare system, and that needs to be implemented much stronger all over Europe.
I mean, your own health minister, Jens Spahn, had some very stark words yesterday that people in Germany are either going to be recovering, vaccinated or dead. I mean, do you think that was a bit harsh, or is that the scenario we're seeing now because of Delta?
It was exaggerated because by reasons we somehow don't know, even people that have close contact to somebody that is infected don't infect themselves. That's always a question of coincidence and factors that we don't know. But there's a serious risk, and I would advise everybody to be vaccinated because the risk of being seriously infected is very high. So exaggerated, but not completely wrong.
I mean, you're obviously a medical doctor by profession. We heard from the head of AstraZeneca today that said that Europe is facing the wave it is because many member states dropped the use of AstraZeneca. Does that ring true for you, from what you know about the vaccines?
Unfortunately, I have to say that's again another nonsense from the head of AstraZeneca, because we have enough other vaccine. mRNA vaccine is available. And unfortunately, we see now that the problem that I described, that the protection is going down after some months, is more serious in AstraZeneca than in the other vaccines. So I would now recommend people to get the mRNA vaccine or a combination. First dose AstraZeneca, second dose mRNA vaccine. But the problem we have is definitely not linked to the non-use of AstraZeneca, definitely not.